Today, we have the privilege of speaking with Dr. Vijay Patil, an eminent medical oncologist, renowned for his expertise in the field of head and neck oncology and brain tumors. Welcome to MVR CanCon 2024, sir. Sir, what is the role of triple metronomic therapy in the recurrent and metastatic head and neck cancers? Can you please share your insights?
Head and neck cancers is one of the commonest cancer in India, and even though it is a very accessible site, unfortunately, nearly 75 to 80% of patients come in locally advanced stage, and the results, in spite of surgery, radiation, chemo, are not that great. So we have nearly 30 to 40% of patients in whom the cancer comes back. Now, most of these patients are from low economic conditions. So, traditional NCCN recommended or ESMO recommended therapies like pembrolizumab or immunotherapy with chemotherapy or targeted therapy like cetuximab with chemotherapy cannot be afforded by these patients. And hence, we developed the protocol of triple metronomic chemotherapy with low dose immunotherapy, which gives very good symptomatic relief in these patients, improves their quality of life, and also improves their life expectancy. And it comes at nearly at the one tenth of the cost of the traditional chemotherapy agents.
Sir, what do you think about the accessibility and affordability of immunotherapy in Indian circumstances?
So we did an analysis of around 14,000 patients in which we looked at these patients, what was the accessibility. The accessibility in Tata Memorial Hospital was around 2.8%. Even in the private class, the accessibility was only 6.2%, and this was accessibility at the start. How many of these patients could have completed the whole course of treatment? It's an open question. So, which means that accessibility for newer agents is poor in India, and hence we need to develop unique protocols in which either we can bring down the dose of these therapies so that it becomes more accessible, or we develop unique new uh, immunotherapies in India which are more cost effective.
Sir, coming to the low dose immunotherapy concept, what is the role of low dose immunotherapy in recurrent and metastatic head and neck malignancies?
So what we saw is when we on low dose of immunotherapy, that is particularly nivolumab, 20 mg to triple oral chemotherapy, it leads to an increase in response rates, which means chances of the tumor decreasing. It controls the tumor for a longer time. It improves the quality of life of the patient, and it also leads to an increase in lifespan of these patients. And all this comes with very low side effects.
Is the low dose immunotherapy concept is applicable to any other site, sir?
So low dose immunotherapy concept is definitely applicable to other sites also. We have a study getting presented this ESMO of pembrolizumab 200 mg versus 100 mg, which is been presented. We are all excited about the results. We have retrospective data which show that low dose nivolumab can be effective in uh, Hodgkin's lymphoma, lung cancer, uh, MSI positive tumors, RCC. So these are 4 5 sites where we definitely have evidence that low dose immunotherapy works in this site.
So, coming to the last question, sir, what is the emerging role of CAR T therapy in brain tumors?
So CAR T therapy stands for chimeric antigen receptor therapy. So what is the idea here is that the immune cell of the patient is genetically modified to kill the cancer. It is CAR Ts have been very successful in leukemias, lymphomas, and multiple myelomas. In solid tumors, they have an emerging role. In multiple solid tumors, especially those which have Claudin 18.2 or cancer testis antigen or NK2D expression, or those like EGFR variant 3 amplifications, CAR Ts have started showing promising response rates of 60 to 70% in patients who have been heavily pretreated. These heavily pretreated patients with immunotherapy and chemotherapy, the chances of disease shrinking was less than 5%. There we have now started seeing shrinkages in the range of around 50 to 60%. Now, particularly in brain tumors, we have seen that there is a CAR T developed for EGFR variant 3, which has got an exciting response rate of around 66%. We know that GBM especially have PSMA expression. So PSMA CAR T can also help in GBM patients. Certain GBMs also have GPC protein expression. So GPC CAR Ts can also help in GBM patients. We have now started seeing that new data is coming for CAR-T therapies with these new CAR-Ts in GBM, and this is a site, unfortunately, where we don't have any second line or third line very good systemic therapy options. So if we get response rates which are sustainable for longer period of time, definitely CAR-T would become one of the important treatment paradigm in brain tumor patients.
Yes, sir. It's a new ray of hope with advanced
Yes,
technology, sir.
yes.
And thank you for the insights and valuable thoughts
Thank
and
you.
experience.
Thank you.
Thank you.